we don't have a plan now, and you're sitting there at 80 with hundreds of millions of other people your age living longer because of medical advances, having less people to take care of them. When you get put into a place, the supply and demand economically is really going to tell you where you have to be. And that's the last place we want, for us and our families to be, and for people that we're watching and that we're talking to here. That's why we want to have this conversation. Hey everyone, welcome to episode 4 of the Easy Care Decision podcast. We are here to talk about the silver tsunami. Silver tsunami.
Yeah, silver tsunami, something that we're already experiencing in healthcare, and we're probably going to talk about this multiple times in this episode, but our people are living longer.
Yep.
Because of the medical advances.
Yes. So, well, and I think I need to I need to define what this silver tsunami is the number of baby boomers that are now going into their later years, into their silver years, we'll say. And we want to talk about the national averages. We've kind of hit more on families and individuals, but it's important to know what the heck is actually going on, not just worldwide, but specifically here in the United States, that is causing, it's bringing problems, I'll say, to the medical world. Financially, it's a burden to families, but also to states and what's going on that way. So when I say silver tsunami, it is talking about baby boomers that are turning 60 and older. And so I'm pulling up the numbers right here, the national average. So it's saying that around 10,000 people are turning 65 every day. So 10,000 people turning 65 every day between 2011 and 2003. So for 19 years, we have 10,000 people a day turning 65. You pair that with this younger generation, Gen Z. I don't have this in my notes. What's before Gen Z? Anyways, the group before that, these younger generations are having less kids. So what's crazy is there used to be this pyramid of, you would see the largest part of the population being more in the middle of that 20s, 30s, 40s, and then starting to shrink at 50s and get more to the top, where that's now flipped, and we're seeing our aging population growing so rapidly. And now we're at this place of, okay, how do we take care of all these people, both, with manpower, but also financially, how that looks like. And so I'm going to lean on you here as the resident nurse, the one that's done this day in and day out on the healthcare side. What are you seeing as a nurse?
So what we're seeing now is, obviously, you've already said one of the issues is we have fewer people coming behind us to replace workers who are falling into that way.
Yes.
Another thing that we've seen is the medical advances, which is a blessing. But what's happening as people are living longer, and as people are living longer, we're seeing a lot more people end up with dementia, where, I guess if I could put this in a nutshell, the bodies are still going, although the mind is declining. And so as that's happening, the confusion's kicking in, and they're needing more assistance with just getting around with those activities of daily living again.
Yeah.
We are tired as nurses, as home health aides.
So, and putting some numbers behind that, they're saying that the average length of time that people live with say, Alzheimer's is 8 years. So when you think of that, if you go back to the last episode where we were talking about just the math behind it and what this stuff costs, if you're in a place in 15, 20 years that's cost $20,000 a month, and you need that care for 8 years, like that, you can have a nice portfolio built up. And those are the things that can really drain this. And so nationally, if those numbers are increasing, we've got 10,000. And actually right now, we're in the beginning of 2025. They're saying for the next few years, up until I think it was 2028, we're going to have over 11,000 people turning 65 every day. So it's just getting even more profound in how many people are turning that age. And so our conversations and why we're having this podcast and doing this is to say, having a plan now, even if we got to get out of this place of thinking it's too late. You're sitting here at, it'd be great if you're watching this and you're 40 and you start playing now. That's awesome. But even if you're 60, 65, even 70, there's things that you can do to kind of start planning for this. Even, financially, there's less and less options as you get older. But as this is happening, if we don't have a plan now and you're sitting there at 80 with hundreds of millions of other people your age living longer because of medical advances, having less people to take care of them, when you get put into a place, the supply and demand economically is really going to tell you where you have to be. And that's the last place we want, for us and our families to be, and for people that we're watching and that we're talking to here. That's why we want to have this conversation. And so, when people are getting care, what are you seeing in the higher end places like the assisted living facilities? How are they paying for that usually?
A lot of it is out of pocket.
Okay.
And I like what you said about the supply and demand.
Yep.
Because the shorter supply of medical staff that we are potentially look at in the future means the cost will probably be higher.
Sure.
It's just that shit has a possible.
Yes. Yep.
But we, part of that trend is we're seeing a lot of these facilities, nursing homes and assisted living facilities, they are putting into place now memory care units.
Yep.
Which will be an added cost because they're having to try to put more workers in these spots.
Right.
So,
because a lot of times those people are physically capable of doing all the things that they need to do, but mentally it's diminished, and so they find themselves wandering in places and just, it's scary for that. They're lost, they're confused, and so you need people there to help them.
absolutely.
So people are paying out of pocket. The other side of this, we talked about last time that Medicare is not going to cover that. Medicaid is there, but the states are feeling the pressure on this big time because of all the things that we just talked about, the aging population. But Medicaid is paid by the states, and states are at a place where they're running out of money. And so what do states do when they run out of money? They tax people. So the state of Washington has already done this. There's other states. There's 12 others that have lined up that they're talking about this. This, again, is in early 2025. So if you're watching this in 2028, you're going to be like, oh, yeah, he called it. My states are doing this. So California's talked about it. Michigan's talked about it. I think it's going to become nationwide at some point. Once one state does it,
For sure.
they all will.
For sure.
But they're starting to tax, through payroll, people that are working to just have some type of long-term care plan in place. And they're incentivizing people, too, to say, if you have a plan now, if you already have a policy, you're exempt from that tax. So that's where states are really making this push to do this, because Medicaid can't keep doing it. Like, they're going to run out of money. And so we talk about the decrease in the workforce that's there. And this goes back to, again, why planning is so important. They talk about it, people that have policies that are paying it or paying out of pocket. A lot of times the numbers on average are one nurse to every 4 patients, if you can pay.
Yeah, it's we're seeing the numbers grow though.
Okay.
In some facilities, it's 1 to 4, and your really small home ALFs. And some of your nursing homes and even some of your larger ALFs, we'll see that number grow to 1 per 30.
Wow.
And of course, this is not the same in the memory care units.
Yeah, there's
more staff.
Yeah.
But there's limitations. They only have so many rooms.
Yeah.
And even now, what we see is there's a waiting list to get into the memory care units. So, and as people are living longer, yes, people are waiting quite a while.
So if there's a waiting list to get into memory care, that means that these, as a family, you're taking care of that yourself. And it would be nice to be able to pay someone to come and take care of whoever that is while they're at home waiting to get into the memory care. And again, like I have to go just on the national average side. You're in the field, you're doing this. So the averages on it are 1 nurse to 4 people when it's self-pay or you're paying yourself. The Medicaid side is 1 nurse to every 16 people on average. So, if you're saying that on the paid care sometimes it's 1 to 30, we can only imagine what the Medicaid side is on that amount of care. A good friend of mine, his dad was in care for over 10 years. And he told me, because his dad was on Medicaid, and just said, every time I went to go visit dad, I had to hunt down a nurse to come change it.
Yeah.
And so how long was he sitting there, in his stuff, like waiting, and if his son doesn't show up to go get somebody, it just comes back to when you have a plan and you have things you've got this stuff laid out, you're in a position to put yourself or your loved ones in the best place to get the best care.
Yeah.
And so,
and to be clear, it's not to say that the facility staff workers in that scenario was doing a bad job. They were doing what they could with sure had.
Exactly.
And, but I would also like to point out in that same scenario, which we see all the time, if you're the family, you are there a lot.
Yeah.
Because you're trying to make sure your loved ones get the best care in that facility.
Yeah.
And if you can't be there for whatever reason, maybe you got your own kids, maybe your job doesn't allow it, then that means the next step is you're probably going to pay someone else's pocket to be there in a facility where they're supposed to be getting that wonderful care that you would expect.
Sure.
Right? Yep. So there's a lot of ways of where people get to where they're having to pay extra people to come in, sure, to more care.
Yes. And so we're seeing that, not just here locally, but the numbers nationally are there. So no matter where you're at and watching this has become a national problem. And why we are so passionate, both on the medical side paired with the financial piece, to say, come up with a plan. Start coming up with that plan now versus, you have an incident or something happens and now you're scrambling to come up with something, because supply and demand is going to force you into something. And if we don't have a plan for that, it's going to cost your family not just time, not just, the resources of, themselves, but also the financial side. And so last episode here that we're going to do, that's coming out next week, we're going to be talking about caregivers and what kind of things that we've seen and stories that we have, and kind of lean into where we're going as a group of Easy Care Decision, of not just educating and informing, but really helping caregivers have a place where they feel like they're seen, they have resources that they can go into. So check out the next episode. Hope this was helpful to share. We want to be able to help you in any way that we can. So we'll see you next time.